All right, now to our first conversation. As Synlab Nigeria celebrates an impressive 20-year journey, we'll take this opportunity to reflect on the milestones, challenges, and contributions that have defined the company's growth in the medical diagnostics field. From the early days to becoming a trusted name in healthcare, Synlab's journey has been marked by innovation, resilience, and strong collaborations. Well, joining us now to explore more about the company, we have Kenneth Okolie, the CEO, Synlab Nigeria. Join me right here in the studio. It's great to have you.
Hi, good morning.
Good morning. Yes,
nice
quite interesting. 20 years so far.
Yep.
That's quite a journey. And I'm one that's been tracking this diagnostics industry for a while now. And definitely we've seen some innovations and definitely price pressures. Also, we trying to get diagnosed, at this time. But tell me about the journey so far and what's been like 20 years.
It's been an interesting journey, right up from the get-go in 2004. And the story is always an interesting one, how it started. Of course, it started by the founders, Dr. Richards and Dr. Pamela Ajayi, and it was born out of a gap they saw in the system. They have a fertility center, and they were not getting the right outcomes they wanted. And after several checks, and they realized that the gap was from the laboratory results they were getting. And this led them thinking that many other people could be having the same issues, and then that led to birthing of then Part Care. Okay, and over the years, it's been an interesting journey from being the first ISO accredited medical laboratory facility in West Africa in 2006, to being at the forefront of COVID pandemic, to being the first to launch several equipment within the Nigerian healthcare space, to, of course, recently also being accredited by the Medical Laboratory Science Council of Nigeria to be part of the training system for new, new graduates, new students being brought into the healthcare space. So it's been a year of several firsts, and it's been an interesting one. I joined the organization a little over 10, 12 years ago, and it's been an interesting journey, frankly.
I can imagine. And talking about interesting, I'm sure you still get flashbacks of the COVID time.
Oh, sure.
When it was all about getting masked up and everybody was all careful about where you're touching and all of that. But talk to me about key contributions from Synlab so far.
I think one of the key contributions, I think prior to when then Part Care, now Synlab started, you didn't have medical laboratory science businesses or diagnostic businesses organized in this way, where it was very structured, forward-looking. You didn't have that, all right? So I think one of the first major contribution was being able to set up a business in this format that has grown to become a chain of over close to 35 centers spread across the country right now. That is a first, because that gave birth to several other investors deciding to come into the space, and that has enriched the healthcare industry overall, because now you have many players, you have several options out there, and these are all organizations competing on the international front. And of course, we've also been able to work with several government agencies and governments, in bringing healthcare closer to the people. And this also, I would say, has been something that for me is very close to my heart, because there's this perception, Synlab is quite expensive and all of that, but when you speak to those who really use the services, it's beyond the price, and for them it's down to the quality of service and what they enjoy at the end of the day.
Right, and talking about pricing, I remember one time, I tried to use a very affordable lab. I tried it, and after he did the test, next thing he told me I had typhoid. And I was like, typhoid, for real? He said, how did you even walk here? The typhoid is very high. I said, really? So and I went to try somewhere else, and I didn't have typhoid. How do you guys maintain standards and quality?
Well, you see, I think that's the bane of our existence. Our processes are, like I say, built on very rigorous standards, processes, procedures, standard operating procedures, and all of that, and a lot of training, of our personnel. I like the example you just raised now about misdiagnosis. That's what I would call it, because out there are different people do different things, okay? And I would say one of the biggest problems we have is there's a lack of standards in most places, okay? People are unable to replicate processes or replicate certain things, okay? And this is one of the things that sets us apart. I'm not saying that we're perfect 100%. There's no business that doesn't have its fault here and there, but we're pretty much consistent most of the time, and the basis for this are the processes and procedures we set for ourselves, which we hold ourselves accountable to, and also we subject ourselves to what's it called now, audits by international bodies, okay? Top on the list is the ISO, okay? And we have this audit, prior used to be 3 yearly, now it's yearly. Okay, and we have all our centers, or most of our centers, subjecting ourselves to these external parties to come and look at us and then say, are we aligning to the international best practices? And over the years, we've been found to actually do things as is expected globally. So the same result you walk into Synlab to get today, if you go to Morocco, go to the US, go to Canada, go to anywhere, you would have exact same result. And if you just spare me 1 minute, there's a story I like to share oftentimes. There was a former president of ours who, for one reason or the other, was managing the condition, and then the doctor said, you don't need to come over to the UK again to come and have this test done. And he said, why? He said, well, there's a lab in Nigeria that you can have it done. He said, you're sure? And you're sure the result is correct and all of that? He said, yes, we send our patients there. And he literally came to our facility physically because he wanted to be sure that this really existed, okay? And that's one of the testaments to what we've been able to do in terms of reversing medical tourism in our own small way as it relates to medical diagnostics.
So that's more like an international recommendation.
Exactly.
At this point.
Exactly.
All right, so, talking about the price
yes.
for most of this
yes.
service, affordability
yes.
and all of that. We know consumers have had a very, very daunting, 2024.
Yes.
And, definitely it's all been about expectation of higher prices
yes.
and all of that. But how can we make quality, affordable, even in your industry?
Yes, I think speaking to the medical diagnostics, making quality affordable, it's an interesting and very intricate process because medical diagnosis, specifically medical laboratory services, is a volume-based business, okay? Currently, I wouldn't say we are outrightly outpriced, and I speak about the industry, especially for the top players. However, I believe that a lot more could still be done, okay? And one way we can do this is by we've been able to really get the insurance system really running as it should be. Currently, we are still at the, let's say, emerging or pre-emerging stages in terms of insurance penetration in the country. Proper insurance penetration in the country is still single digits, still less than 8%, okay? And this has a huge impact because a lot of people still have to pay out of pocket, okay, for their test and all of that. And of course, if someone has to choose between eating, going to church, seeing the prayer pastor who he doesn't need to just pay his offering, okay, he doesn't need to pay anything to, and then coming to do a particular test, okay, he would rather first pray and maybe take some herbal mixtures before. And oftentimes what we see is that things really get bad for a lot of people who do not have the income or the access before they're actually visiting proper medical facilities who then direct them, you need to do this test, do this test, do this test to be able to get the right care. So I would say if we can get the insurance aspect right, because in most of the developed world, this is what is working for them, okay? So if we can get that right, I know there's a lot of work being done around it, and the earlier we can get that right, that will really help with regards to affordability. And
I believe you don't reject HMO patients.
Oh, no, not at all.
Oh, fantastic.
Not at all.
Fantastic.
Not at all.
So marking 20 years,
yeah.
how are you guys looking to celebrate?
Oh, wow. Okay, so for us, it's been an interesting period. We've done a lot from having outreaches, because for us, it's also an opportunity to see how to push forward what our mission really is, which is helping partners, be them doctors, patients, whoever, being able to help them achieve better health outcomes so that they can live healthier lives. So we've partnered with different organizations to have health outreaches out there. We've launched some products which speaks to the issue of affordability and accessibility, where we're looking at how to help people pay small, what's it called? For people in the diaspora, they can take care of their parents and loved ones in Nigeria by buying gift cards for them and doing different things. All of this is just to see how we can bridge that gap and help people access healthcare, okay, in an easy and as much as affordable as possible way it can be.
All right, so what are we seeing for the next 10 years?
The next 10 years is going to be interesting. Of course, we're looking to invest more in Nigeria. We're looking to work closer with the government. Currently, we have about 4 to 5 public-private partnerships where we have, working with the government, we're able to situate state-of-the-art labs within teaching hospitals. So this serves as a support to the existing infrastructure which the government has. But beyond that, we're really offering something different, because prior to now, patients would need to move between, let me give an example. We have a PEP in Benue State, inside the Benue State Teaching Hospital. Prior to now, when they want to do specialized tests, they will need to travel all the way to Abuja, okay, to have this test done. And there's so many complaints. Imagine the cost and all of that. But now you're able to access world-class healthcare within your locality, okay? So we're looking to have more of this. We're looking to become a hub for medical laboratory services within the West African sub-region, so that a lot of people don't need to send tests abroad. When I say abroad, to Europe, to America and all that, you can send them to Nigeria, okay, whatever test it needs to be, PCR, precision medicine. We're looking to invest heavily over the next 10 years to expand our base. And also, we're looking to really work with regulators to enhance the way this practice and the business environment is in Nigeria. Because at the end of the day, if we don't have strong regulations, okay, that ensures that the business environment is fine, protects the patient, protects the business owners, protects the investors, it limits what can be gotten out of the industry. All right, so these are some of the things we're looking to do over the next 10 years.
Fantastic. And, fun fact, what I really like about, people in your industry, you guys are very clean. Oh. And I can see it from your outfit.
Thank you.
It's really white.
Thank you very
so
much.
Clean. It was great having you. Kenneth Okolie, CEO, Synlab, Nigeria. Thank you for coming on.
Thank you. My pleasure.